As a child, I had several health conditions that required me to be in the hospital and have some surgeries. My mom is a nurse, so I actually had all of my surgeries done at the hospital where she worked. And I was one of those unusual cases where I loved being in the hospital. I helped the nurses, I went around and visited the other kids. I think that's one of the main reasons I decided to go into medicine. When I first started medical school, I thought I was going to be a surgeon or go into pediatrics, but as we went through our rotations, I really was drawn to OB/GYN and ended up really enjoying it. I like taking care of the patients. I like doing surgery, delivering babies, being in the office, and that's how I made my decision. I think one of the most important things we can do as physicians in taking care of women is to listen to our patients, try to understand and empathize with what they're saying, and think about our response before we give it to the patient. Most of our patients want to know that they're being heard and understood and that someone's taking their concerns seriously and trying to understand what they're really going through. One of the things that I've noticed in my career as an OB/GYN that's been helpful for me is comparing the experiences that I've had as a patient to the experiences that my patients may be having. Sometimes I might feel like I'm getting a little bit too personal about my own history, but I find that most patients respond to that really positively, and it makes them feel that I can really understand where they're coming from and the concerns that they have. I have an 8-year-old son. That's just the joy of my life. And I spend most of my free time with him. I'm involved with his school as a homeroom parent. I also enjoy traveling. I just got back from a trip to Jamaica. I also enjoy shopping. I like to cook. Curtis and I just started taking cooking classes together. And I'm very blessed to have a great support system of family and friends that I like to spend time with as well.